I job shadow 3 nurses, that one worked in a hospital, one was an FNP, and one was a psychiatric nurse practitioner. And I was like, motivators, welcome to Motives to Life. My motive is to stay up, never down. My name is Becca Banks. Just if you guys do not know me, on my channel we talk all things nursing, God, woman empowerment, and a little bit of vlogs here and there. This video is going to be talking about graduate school. Yes, your girl is back in school. I can't believe I'm back in school. Like, that's crazy. I'm like, literally, I cannot believe I've been in school now almost for like, it's going on a year. I think I've like, oh my gosh, like I'm just counting down because I'm exhausted, y'all. Like, I'm a little bit on break right now, so I have time to like do all these other things that I'm doing on the side to help nursing students, to help to make my YouTube videos, just happy doing what God wants me to do, living life and just being free-spirited. But anyways, I'm going to talk about graduate school and why I chose what I chose. So as you all know, if you've been watching my videos, I stated that I am back in graduate school. So if I'm not responding to some of you guys' emails on time or your text messages on time, I'm sorry. Don't hate me. I think there was a girl that sent me messages. She was thanking me of all what I told her of how to pass nursing school, her program, and her test that she was taking. And I haven't responded to her. It's been like almost a month, and I'm like, if you're watching this video, I'm sorry, girlie. I will get to your message. I promise you. I will get to your message. But yes, I'm back in graduate school. But before I went back to graduate school, I didn't tell anybody. I wanted to first apply, started, accomplished the first semester, second semester, you know. Then I'm like, okay, I can start telling people, because I'm learning to not just put things out there, because not everybody is going to be happy for you. Not everybody is going to wish you well. Some people is going to look at your pictures that you're in school and they're automatically going to be like, whatever, why is she in school? Whatever. I hope she, you know, people just I don't want that negativity. Like, I don't want that. I didn't want to put that out in the air. But I know God is with me, because when I first started my program, my grandmother that passed away appeared in my dream the first day. She appeared and I was in my white coat. I was in my office in the dream. I didn't even start school yet. It was my first day of class, and there was like, oh, there was a visitor coming for you. And the visitor was my grandmother, and she was like, she came visit me. She bought me food to eat, and that was her way of telling me not to give up, not to stop going to school, and to continue, that I'm going to accomplish it, because I already saw myself in that white coat that I'm in school for. So I'm just grateful to God. Yes, I'm in school for a psychiatric mental health nurse practitioner. Now, some people may be wondering why I chose psychiatric nurse practitioner versus FNP. Initially, I was going for family nurse practitioner, or acute nurse practitioner, or psychiatric nurse practitioner. And I did my research. I job shadow 3 nurses, that one worked in a hospital, one was an FNP, and one was a psychiatric nurse practitioner. Before I chose what I chose, because y'all, let me tell y'all, I've been in school all my life, and I ain't trying to go back to school after this program, even though I probably will. I'm not trying to go back to school, but I wanted to go to school for something that, you know, that will make me great amount of money. Not only that, but something that I love, that's something that I care for. So I chose psychiatric nurse. I chose mental health nurse practitioner versus FNP. Now, I did my research on both of this stuff a lot. I was researching for about 3 to 4 months before I actually just went into like what I want to do, because I'm like, what do I really want to do? What I want to do? And let me tell y'all, I didn't choose my specialty. My specialty chose me. Yes, it chose me. Y'all, every time I'm taking care of patients, they are always telling me about their problems. They're always telling me about their depression, their anxiety, their worries, their bipolar. And literally every time I go to work, I get these patients. Like, they love to give me crazy patients. They love to give me patients that are difficult. They're like, oh, Becca is coming in today. Oh, she can handle them. I'm like, okay. Maybe I'm a little bit cuckoo myself. But yes, I chose, all jokes aside, it chose me because I'm very intrigued on hearing people's problem. I love to listen to people when they talk about their problems, talk about their situations in life, when they talk about things that they're going through, and how to treat it medications wise. And I listen. And one day, when the day that I decided to, like, okay, I'm going for mental health, I'm going to specialize in mental health. That's one day, a family member, I spent about 30 minutes talking to a family member. And she came outside. I got chills, y'all. She came outside and from the room. I was leaving, and she came. She was like, I want to just talk to you. I just want to thank you for not only being my mother's nurse, but also being my therapist. And as a mental health nurse practitioner, you can also do therapy as well. And I'm like, okay, that's it. It's my calling. All right, people love to tell me their problems. People love for me, you know, it's just it. And I love, and I'm so intrigued by schizophrenia, bipolar disorders, depression, anxiety, how to treat it, what to do, and the mental health. Like, literally, our mental health is so important. So that's why I chose to be a mental health nurse practitioner. That is the number one reason. Number two, the flexibility of mental health and mental health nurse practitioner versus FNP is different. Mental health nurse practitioner, most of them is telehealth. You can work from home. Shoot, you can even work from the beach. Okay. Anyways, yeah, you can work from home. You can work from anywhere. Talking to patients, you can do telehealth. Okay, and I saw that, and I have a friend who. One day he goes to the office, and 3 days he works from home. And I told myself, I don't have no children right now. I'm not married right now. I'm like, one day I will love to be home taking care of my babies. Cause y'all, when I get married, I wanna pop them like popcorn. I'm joking. But anyways, I would love to be home taking care of my babies, and also I'm working. Like, what ways to just do both at once? The flexibility, the hours. Like, I know someone that work Monday through Thursday, 10 hours as a mental health nurse practitioner. And she has Friday, Saturday, Sunday off. Now, when I went to FNP, it's not as flexible as psychiatric nurse practitioner. You have more patients as an FNP versus a psychiatric nurse practitioner. You see up to like 30 patients a day versus FNP versus psychiatric nurse practitioner. You see about like you can see up to 12 patients, up to 15 patients. It all depends on where you're working at. And I'm like, y'all, I'm not trying to be at the hospital every single day, seeing about 50 patients, going home late, 10 o'clock, being exhausted, having to do all the notes. When I did my job shadowing, I was like, ooh, yeah, yeah, no, yeah, no, yeah, I'm just like, nah, yeah, no, nope, nope. But other than that, I also have a friend that works in women's clinic as an FNP. I'm like, that is really cool. Like, the hours are very flexible too. She works 10 hours a day. I think Monday through Thursday. I forgot what she told me, but she works 10 hours a day, and I'm like, I can do that too. I'm like, that's the only good thing I've seen so far of FNP. And I'm like, okay, that's something I can see myself doing in the future as well. So maybe in the future I will go back to school just to get my FNP. But for right now, my goal is to be a psychiatric nurse practitioner because I just love it. It's my calling. I love people. I love hearing people's problem. I love finding solution to solve problem. What I need to prescribe antidepressant medication for you, what I need to give you, need to, like, you know, send you off to therapy. I love it. I just love it. I really do love the mental health part of it. 3, the mental health is expanding so much. For those of you that do not know, I do live in California, and over there NISM signed a bill about mental health. Is really is mental health treatment is just as critical as a medical treatment. So it's very important that the mental health field, ever since COVID hit, it has been just growing drastically, and I'm just like, yeah, that's where I'm going. versus the FNP, you're kind of a little bit limited on like jobs. Like you start in some people start in a clinic, some people start in a hospital, you know. But when it comes to like the varieties of things to do, FNP definitely have it. Like you can work in beauty, you can work in aesthetic, you can work with so many people, you can work with older, younger, versus psychiatric nurse practitioner. I'm literally kind of limited to just mental health. So you know, it kind of has its pros, its cons and pros. And also lastly, why I chose psychiatric nurse practitioner is because of the pay rate versus FNP. Y'all, I'm gonna be realistic with y'all. I'm not finna go to school and work this hard and get paid less than what I'm getting paid right now as an RN. No. Because no. Because no. No. Because no. I don't know how many times I'm gonna say no, but no. But however, there's some, depending on where you start in the job, there is some FNP that do get paid very high rate. I know someone who's getting paid 55 as an FNP. And I'm an RN. I'm getting paid higher than that right now as an RN. I know someone who's getting paid 60, 70. It all depends on how much. It depends. To be honest, it depends on where you work. So don't mind me if I'm saying about the pay rate. However, the money is higher because psychiatric nurse practitioner is a specialty. Like, and it's a critical specialty too, because you're playing with people's mind. You it's like chemistry. You trying out this medication, what works for them. Antidepressant medications have a lot of side effects. All this antipsychosis medication have a lot of side effects, so you have to be careful. And lastly, the pros and cons of it. Psychiatric mental health versus FNP. Psychiatric mental health get more sued than FNP. You have to be really careful in the medication that you prescribe, because psych drugs are really, they can be really dangerous to the human mind, the human body. They have a lot of side effects. So you have to really be careful on what you're prescribing. You have to really know your stuff. That's why I'm like, I don't care what I know, as long as I know, one, the diagnosis, and two, the medications from head to toe, and know all the side effects of all psychiatric medications, I'm good. Because one thing I do not ever want to do is just prescribe medication just to prescribe medications. Like, I don't want to do that. I want to really know my stuff. So I'm really paying attention to pharmacology. I'm studying all the time when it comes to mental health. So yes, that is why I chose psychiatric mental health nurse practitioner versus FNP. However, I do not want to lose my skill as a registered nurse. So I am going to keep my registered nurse license, and I'm going to keep my job as a registered nurse, because I have a permanent job where I'm staff and I work there per diem, and I'm going to keep that per diem job. It's only 8 shifts in 3 months. It's really nothing. So I'm going to keep that I'm going to keep my job. So I just wanted to check in with my nurse fam and just let you guys know what I'm up to, and to talk about FNP versus psychiatric nurse practitioner. And that's why I chose what I chose. I did my research. And if you're thinking about going to school after you finish nursing school, please do your research. CRNA is great too, but I'm not about to put people to sleep every day for the rest of my life. Like, nah. It wasn't for me. I didn't start off at critical care. I started off at med surg, tele, step down. But that would have been cool too. But no, I don't have time to learn all this chemistry stuff all over. So, so no. But there's CRNA. There's acute care NP. There's midwife. There's psychiatric nurse practitioner. There's FNP. And I chose psychiatric nurse practitioner. And there's also pediatric nurse practitioner. But I wanted to just go where just do what I love to do. So that's why I chose what I love to do. But everybody's different, so find your calling and do what you have to do. Thank you guys for watching my video, my nurse gang. I love all of you guys. I hope you guys are all doing well, and stay tuned for this PDF book file that's coming soon. I'm going to make it, and I will also include on that file, I'll also include giving report in clinical and giving report as a new grad. I need to talk about being a new grad. I'm just lagging it, but I need to make videos on more videos on a new grad. But let me know what you guys want me to talk about as far as like about nursing. Let me know on my comment below. Thank you for watching. Thank you for staying tuned. Remember to stay up, never down, and have a blessed day. Bye.